Hello, and welcome to our webinar on chronic care management in 2022, what your practice needs to know and how DAS can help. I want to briefly mention that this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. Okay, so on to today's webinar on CCM. My name is Chelsea Grover. I'm the marketing manager at DAS Health. DAS Health is a leading provider of health IT and business solutions and a trusted consultant to independent and enterprise physicians groups, hospitals, and healthcare systems across North America since 2003. We deliver superior information technology, MSP managed IT, cloud hosting, RCM medical billing, value-based care, patient engagement, compliance, and practice management solutions for over 30,000 users nationwide. As always, we are delighted to help keep you informed on industry-related subjects that you need to be aware of. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention that this webinar will be recorded and that we'll send out a copy of the slides and the recording within the next week. Okay, so some quick housekeeping notes. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So, without further delay, I'd like to introduce our presenters for today. Lindsay Lanning is Client Development Manager, and Brandy Bond is Product Manager at DAS Health. They're both super eager to share their knowledge with you today. So with that, I'm going to let them get started. Lindsay, it's all yours.
Great. Well, thank you, Chelsea, and thank you everyone for joining our webinar today on chronic care management, or CCM, as we'll refer to it throughout the presentation. As we all know and have seen recently, chronic care management technologies and protocols are becoming increasingly popular due to the benefits not only for your patients and your providers, but your practice's bottom line as well. So CCM, or chronic care management, is a specific care management service that provides coverage for patients with 2 or more chronic conditions for a continuous relationship with their care team. So basically what this means is CCM is going to be any sort of care coordination that's happening outside of the regular office visit for patients with multiple chronic conditions. And it's been proven to be a critical component of care, leading to better health outcomes for people with many different types of health conditions. So specifically today in this webinar, we're going to provide an overview of federal policy, current reimbursement, and best practices to launch your own CCM strategy in 2022. So we're going to explore the essentials to a successful CCM implementation, as well as the benefits that this service may offer your practice that many may not realize. Really what we've seen, and kind of all signs point to this, is that now is the time to consider implementing CCM in your own practice. We're seeing firsthand how COVID-19 has allowed CCM to gain substantial buy-in from patient populations that may have been somewhat skeptical years ago, and not to mention a rare increase in reimbursement rates from CMS for these services this year. Now, towards the end of the presentation, we are going to showcase DAS Health's, turnkey comprehensive CCM service offering, where we have our expert on the line to answer any questions you may have. Really, our goal today is to show you, by partnering with a trusted healthcare solutions provider, using proper reimbursement, healthcare practices like yours can actually maximize care and decrease patient health costs, all the while increasing your practice's revenue. So again, just to provide an overview of what we're going to cover today, here's what's on the agenda. We're going to go over a very brief overview of what CCM actually is and explore how it works in real life. We're then going to look at who's eligible, both on the patient and the provider side for CCM, which will lead us into providing you kind of a generalized idea of reimbursements. We're not going to get into the super nitty-gritty here, but we're going to focus on what's required and how to bill and what kind of return you could see after implementing this service. And then finally, we're going to look at how you would roll out this program, at first on your own in your own practice, and keeping this internal, but also, if you are interested, how DAS is here to help as well. So basically, our goal is to look at the clinical and financial benefits of CCM and answer some key questions that we hear a lot. Who can order, provide, or bill for CCM? What patients are eligible for this? What are the requirements, and how do we even go about implementing this right now? So let's go ahead and kind of jump right in here. First and foremost, what is chronic care management? Well, in short, chronic care management services offer additional help managing chronic conditions. So this is going to include a comprehensive care plan that's going to list the patient's, health problems and goals, their other providers, their medications, community services, and really any other information about the patient's health. So in more technical terms, chronic care management is a specific care management service that provides coverage for patients with 2 or more chronic conditions and allows them a continuous relationship with their care team. So what surprised you, or what at least surprised me, may surprise many of you, is the fact that, looking at that fact on the screen from CMS, there is an estimated 117 million adults that have 1 or more chronic health conditions. And 1 in 4 adults have 2 or more chronic health conditions right now. I saw that 1 in 4, and that really, really wowed me. So when we're trying to explain CCM, using some statistics like this to catch people's attention, but trying to break it down to not at a technical level, but to your peers or even to your patients, we describe it as a cumulative effort of the clinical care team to maintain and improve the health of their patients with complex and ongoing conditions. So you can provide examples when explaining this to your patients. These efforts include, monitoring them, counseling, treatment and educational services provided in conjunction with their goals. It's really the care coordination that happens outside of the regular office visits for patients with multiple chronic conditions, which is extremely important when you consider, these staggering statistics. Did you know that 1/3 of Medicare beneficiaries have 4 or more chronic conditions? Or 7 of the top 10 causes of death in 2019 were actually from chronic diseases. Also, people with chronic conditions account for about 86% of the national healthcare spending. And people with chronic conditions receive only 56% of recommended preventative healthcare services. And lastly, certainly not least, 99% of Medicare spending is on patients with chronic conditions. Each one of these figures shocked me, but looking at them all together, my jaw about hit the ground. Who knows, maybe I've been living under a rock, but I just didn't grasp the sheer volume and critical need for more CCM efforts immediately until creating this very slide. So this is our why today. This is why Brandy and I are so passionate about CCM and about our offering to help all of you help your patients that are falling into 1 or more of these buckets, and really put on this webinar to spread the word that we're here to help, and the time is absolutely now. So I think we already emphasized why CCM is so important, based off those stats alone, but really looking at the role it plays if implemented. Your patients will gain a team of dedicated healthcare professionals who can help them plan for better health and stay on track for good health. Each one of those patients is going to receive a comprehensive care plan. This plan is going to help them support their disease control and their health management goals. That's going to include everything from physical, mental, cognitive, psychosocial, functional, and even environmental factors. These patients are also going to receive improved care coordination. So CCM is going to help improve that coordination and health outcomes. And the best part, you're going to receive payment specifically in support of your provision of care using this approach for a patient when you provide a minimum of 20 minutes of these CCM services a month. It's going to support your patient compliance, and it's definitely going to help your patients feel more connected to your practice and give them the support they need between visits. And last but not least, it's going to sustain and grow your practice. Ongoing care management outside of in-person visits, it's not always been a separately billable payment. It is now, and previously it was very difficult for practices to sustain this type of service without that ROI in place. So at this point in time, CCM can provide you with additional resources to help your practice, care for those high-risk, high-needs patients in the form of, reimbursement. We're seeing practices that do not offer CCM services right now are really missing out on the opportunity to one, provide enhanced connected care to their Medicare patients that they need and want, while also getting paid for it. So I know I've, already been talking about the benefits of CCM, but there are, a few on here that we haven't yet addressed, which are important. One of which is being the combating clinician burnout. So you might be asking yourself, how in the world could this help with burnout when this sounds like a lot more work for my team? Well, one way is that you could outsource CCM to a trusted partner like DAS. You wouldn't be responsible for all the patient follow-up or outreach. We in particular have our own care managers who facilitate this. But besides that, in general, you're also participating in much more frequent outreach, which leads to improved access, patient compliance, and health outcomes, all of which mean less acute care visits for this patient at your practice. Not only that, but what we found is that during these CCM visits is many times these care managers are answering questions about medication management, or just overall general health education. And these are reallocating those questions that would have originally gone to your practice as a phone call or a portal message to those care managers. So I won't go through all the rest of these. I mentioned, a lot of them in some way, shape, or form previously, but we can see CCM is a critical component of primary care that's going to contribute to better outcomes and higher satisfaction for patients, all the while providing a way to optimize revenue for your practice. That's kind of the main point to take away today. Okay, so I did promise a very brief overview, and I hope I delivered on that. We do have a poll question for you all to answer, and I'm going to call this poll question a pulse check for two reasons. One, to see if you all are alive, and I didn't bore you to death with that introduction, but two, to also see where the majority of you on this call fall in relation to CCM utilization. So our question is, have you ever billed for chronic care management services before? And there's a few options. The two first ones being yes. So first one is yes, and we were somewhat successful. The next one is yes, but we actually didn't get many patients to enroll. Or no, but we're looking into it now. Or no, and we're probably not interested. And if your answer is D, I hope we can sway you otherwise. But other than that, we'll give everyone, 1 or 2 minutes here to go ahead and answer that poll. Chelsea should have it open, so it should be popped up on your screen to go ahead and answer and submit.
Yep, it is currently open, so if everybody will just take a quick look at their screen, and we're going to go ahead and close this in just a few seconds here so we can keep on and keep going with the more informational stuff. So we are going to close this in 5, 4, 3, 2, and okay, perfect. So again, we just wanted to do this so that we could do a pulse check and make sure that we were covering the information that was really most important to you in your practice. And so thanks for everybody sharing your input. And with that, Lindsay, go ahead and keep it going. Thank you.
Perfect. Thank you, Chelsea. I was waiting for like a 2.5, 2.25 countdown.
You know what?
But
It's Tuesday. Sometimes no, it's Wednesday. It's Wednesday. See, this is why I don't do the counting. I keep it
Awesome.
simple.
Love it. Okay, well, thank you everyone for participating. These responses are extremely helpful to our team to get a better idea, like Chelsea mentioned, of those of you on the call and where everyone's currently at. So we appreciate it. So moving on to our CCM requirements and eligibility as promised, to really kind of, get in the meat of the presentation here and look at some of the informational, key informational items here to know when launching your own CCM program or to be aware of no matter what if you outsource this or not. So first and foremost, let's look at what patients are eligible to be enrolled in CCM at your practice. CMS specifies those eligible are patients with multiple, meaning 2 or more, chronic conditions that are expected to last at least 12 months or until the death of the patient, and that place the patient at significant risk of death, acute exacerbation or decomposition, or functional decline. Those are the patients that are eligible for CCM services officially. Now, some chronic conditions, we see patients enrolled in CCM. What conditions they have are going to be, arthritis, asthma, we've got diabetes and depression. I think hypertension and COPD are some common ones that you're likely used to. Even infectious diseases or some substance use disorders, as well as autism spectrum disorders and even cancer. Now, this list is obviously not exhaustive, but they should get your wheels turning when you're thinking of your own patient populations and who may be eligible from your practice. Now that we know what patients qualify for CCM, what clinicians can actually provide CCM services. So CMS identifies both locations and provider types. So the locations that allow this include physician offices, FQHCs or federally qualified health centers, rural health centers, and critical access hospitals. Now, the physician types or provider types include physicians, certified nurse midwives, clinical nurse specialists, nurse practitioners, and physician assistants. Now, an important note, which I included word for word, so you can reference later on when we send out these slides, is that one, all providers must be licensed in the state that the patient is receiving care. Now, this may seem obvious, but with the current telehealth landscape, some of these restrictions, have been lifted for the public health emergency. So I wanted to clarify for CCM, the provider needs to be licensed in the same state they are providing care to a patient. And number two, the CCM service cannot be provided by any sort of limited licensed physicians and practitioners. So think clinical psychologists, podiatrists, or dentists. Now, although these practitioners, can still consult or refer, be included in care, with the other types of physicians that are allowed to coordinate and manage care and provide CCM services, they are not the ones who would be allowed to actually be the initiating and providing clinician. Okay, so now that we know who is eligible both to receive and provide CCM services, let's look at what this includes in the eyes of CMS. So first and foremost, it includes assessing the patient's health, mental, and psychosocial needs. It includes ensuring all your patients receive recommended preventative services or care systematically. You're going to provide these patients who are enrolled in this assistance with medication management. That's a big part of it. And then, of course, managing the patients who are enrolled in CCMs, their transitions of care between providers and healthcare settings, typically through sharing a comprehensive care plan. And then last but not least, allowing them, 24/7 or just allowing them access for urgent care needs whenever they need them, both the patient and, the patient's caregivers. So again, rounding this out or summarizing this, basically the patient's going to be given support when they go from one healthcare setting to another. They're going to expect their medications to be reviewed and how they take them, and then they're going to receive help with all their other chronic care needs. Now, there are some specific elements outlined by CMS that must be met. The first revolves around the initiating CCM with the patient. So a CCM initiating visit can actually be an annual wellness visit, an initial preventative physical exam, or even a transitional care management visit, really any other type of qualifying face-to-face E&M. However, this is only required for new patients or those who have not been seen in the office within a year prior to starting CCM. An important note to make, so you all know, that CCM initiating visit, when applicable, is actually billable separate from that monthly CCM service as well. Next, we have the structured recording of patient information using certified EHR technology. This is the structured recording of demographics, problems, medications, and medication allergies using a certified EHR. So they're going to be looking for a full list of problems, meds, and those medication allergies to inform the care plan and care coordination and ongoing clinical care. So CMS does require that use of certified EHR technology to satisfy some of these service elements. So when you're actually furnishing these services, CMS is going to require the use of a version of certified EHR that's actually acceptable under the EHR incentive program as of December 31st of the calendar year preceding each Medicare physician fee schedule payment year. So I know that sounded like a mouthful, but I'm sure most of you on this call actually probably participate in MIPS or are part of an APM, maybe an ACO, Medicare Shared Savings Program, some sort of quality program that you're participating in that already requires this certified EHR or CERT to be in place. by these programs. So this is following along suit. Likely, like I said, as long as you're reporting under one of those programs and you have that in place, this shouldn't be an issue. But just a good call out that CCM does require it as well. The next requirement refers to access to care. So specifically, CMS states practices need to provide 24/7 access to physicians or other qualified healthcare professionals or clinical staff, including providing patients and their caregivers with means to make contact with healthcare professionals in the practice to address urgent needs, regardless of the time of day or day of the week. As well as continuity of care with a designated member of the care team with whom the patient's able to schedule successive routine appointments with. So I know 24/7 access sounds a bit intimidating, but the intent is to provide enhanced opportunities for the patient and any caregiver to communicate with the clinician regarding that patient's care. So this access could be through the telephone, it could be through secure messaging, secure internet connection, transmission, or any sort of non-face-to-face consultation methods as well. Next, we have the comprehensive care management. I think this one goes without saying what we've recapped, but just to go over it one more time, this is the care management for chronic conditions. So it's going to be that systematic assessment of the patient's medical, functional, and psychosocial needs. System-based approaches to ensure the timely receipt of all of those preventative care services, that med reconciliation, as well as their med adherence, and any sort of oversight of patient self-management of medications. I get it, it's a little bit obvious, but it is a requirement. The next requirement I know we've also, touched on, but formally CMS requires a comprehensive care plan. That includes the creation, the revision, or the monitoring of that care plan for all health issues with a particular focus on the chronic conditions that are actually being managed. We're going to dive deeper into this in the next section with Brandy on kind of what's included and also how the DAS service can generate this for your practice. So along those same lines, care teams are also required to manage transitions between and among healthcare providers and different settings. So this is going to include referrals to other clinicians, follow-up after an emergency department visit or a facility discharge. What this really means is creating and exchanging and actually transmitting continuity of care documents. So think CCDAs and sending those out and sharing those in a timely manner with other practitioners and providers when needed. And last, but certainly not least, is patient consent is required. So the provider must inform the patient of the availability of CCM services, that only one practitioner can furnish or be paid for these services during a calendar month, and the right to stop the CCM services at any time. And this needs to be documented in the patient's medical record that the required information was explained and whether the patient accepted or declined the services. Again, this is going to be another one that Brandy's going to hit on and go over in greater detail in the next section, but we did want to include it. So without further delay, I'm going to go ahead and turn it over to Brandy to go over what billing looks like for CCM, as well, how to roll out this service in your own practice, and of course, how DAS is here to help if you so choose. So Brandy, it is all yours.
Hello, it's my pleasure to speak to you today about the CCM program. Today I will be discussing billing, implementation, and what DAS has to offer your practice with our turnkey CCM solution. Medicare has 3 specific goals in creating new billing opportunities for CCM services: improve the quality and coordination of patient care, decrease the volume of patient visits to the hospital and emergency departments, decrease overall healthcare expenses to the patient and the practice. These goals have become extremely important as every day in the US, 10,000 people turn 65 years of age, and the number of older adults will more than double over the next several decades to top 88 million people and represent over 20% of the population by 2050. CMS outlines the following billing restrictions. Only one practitioner, as Lindy discussed, may be paid for CCM services for a given calendar month. Therefore, you might really want to check with and coordinate with subspecialists who might be providing a significant amount of care for these patients and treatment for one or more of the patient's conditions. It is important that the patients understand that only one of their multiple physicians can be able to provide CCM services for them. CCM service codes provide payment of care coordination and care management for patients with multiple chronic conditions within the Medicare fee-for-service program. Medicare will not make duplicate payments for the same or similar services for patients with chronic conditions that are already being paid under the various programs that CMS offers, like CPC Plus. Skilled nursing facilities, they will not bill for services for patients that are in skilled nursing facilities or hospital patients for Medicare Part A. Today, we're going to cover the most commonly billed CCM code 99490, Chronic Care Management Service, that requires at least 20 minutes of clinical staff time directed by a physician or other qualified healthcare professional and can be billed every month. This code requires a personalized care plan and a certified EHR with a copy being provided to the patient. There are other codes that can be billed for CCM, and those codes and a detailed explanation of each of those codes can be found on the CMS website. Reimbursement rates have increased for 2022 for chronic care management, with a $22 increase seen for the code 99490. For care management services, CMS is adopting the American Medical Association RVU update committee's recommended increase in the assigned relative value units. As a result, there will be a significant increase in Medicare reimbursement for these services for 2022. This is a win-win for everyone. With the increase in reimbursement rates, now is the time for you to start a CCM program in your practice. Providers not only receive payment for providing care coordination, but may also improve practice efficiency and patient compliance and satisfaction. CCM requires patient consent be obtained, providing an opportunity to explain and engage the patient in goals and activities of CCM. When obtaining a patient consent, the patient should be aware of the 20% cost sharing requirement for each month of CCM service. Verbal or written consent must be documented in the EHR and include, and when asked the questions, if they have received CCM services from any other providers, do they agree to receive CCM services from you, and if they understand the monthly fee that could apply. The copay is 20%, that equals about $8 a month for the patient, unless they have a supplement, and then usually the supplement will pick up that copay for the patient. And really important is how they prefer to be contacted and what's the best time for your practice to contact them, so you're not interrupting their schedule and that you have a better chance of catching them at home and not having to make multiple phone calls. They also have the right to stop CCM services at any time. Informed consent is only required once prior to initiating CCM services, or if the patient chooses to change the billing provider for their CCM services, they would have to give consent again. Next, we'll look at care plan requirements. Establishing, implementing, revising, or monitoring an electronic comprehensive care plan for the patient that tracks their health issues and sharing it with the patient and their caregivers when appropriate. Many EHR applications now offer customized care plans inside the EHR, and a lot of those come with time tracking ability as well. When you're customizing your comprehensive care plan, it's important that you include the elements: problem list, expected outcome and prognosis, measurable treatment goals, symptom management, planned interventions, and identification of individuals responsible for each intervention, medication management, community and social services ordered, description of how services of agencies and specialists outside the practice are directed and coordinated, and schedule for the periodic review and revision of the care plans. This, of course, is not all that can be included on a care plan. That is based on what services you want to offer your patient for your CCM program. Documentation is a vital part of the CCM program. To document the CPT code 99490, it requires 20 minutes of non-face-to-face clinical staff time. Each individual practice will need to develop its own personalized, consistent system of documentation based on its unique physical, staffing, and EHR makeups. This consideration should include documentation of care provided by both internal and external individuals, who and how care will be recorded, and how to record and document time spent doing different aspects of care and coordination. It is possible that there will not be a CCM code billed for every patient every month, as some months may not generate the necessary 20 minutes of care coordination. You couldn't get a hold of the patient, that kind of thing just didn't add up for the 20 minutes, so you won't be able to bill for that code for that month. If after hours care is provided by a clinician that you contract out with for call coverage, then that individual must have access to the electronic care plan. The care plan should be able to be accessed via a secure portal, a hospital platform, a web-based care management application, through Health Information Exchange and HIE, or EHR to EHR interface. There are several ways to meet the 20-minute requirement outlined by CMS. Providing CCM for patients outside of an in-person visit, such as a phone call or through secure email. CCM also includes care coordination activities that are not typically part of a face-to-face encounter with the patient and can include telephone communication, review of medical records and test results, self-management education and support, and coordination and exchange of health information with other practitioners and healthcare professionals. It may also include some face-to-face interaction with the patient and other healthcare professionals, sharing patients' health information, including their electronic health plan with the patient's other healthcare providers, managing care transitions, including providing referrals for the patient to other, and facilitating follow-ups for the patient after their discharge from the hospital. Also coordinating home and community-based services, providers, and documenting this activity in the patient's health record. Prior to 2022, rural health clinics and federally qualified health centers were not able to bill for CCM and TCM services or other programs that provided additional payment for care management services for the same beneficiary during that same time period. Now in 2022 and beyond, CMS will now allow RHDs and FQHDs to bill concurrently for care management services. This means that going forward, RHDs and FQHDs can provide CCM, TCM, and other care management services for the same beneficiary in the same service period. Rural and federally qualified clinics may now utilize that CPT code G0511 for a higher billing rate. This increase showcases CMS's interest in expanding access to such programs for patients living in rural areas where immediate access to healthcare may not be available. So this is a really amazing program now that they are able to be a part of it. Now that you have a basic understanding of billing and who is eligible for CCM, let's discuss how to implement a CCM program into your practice. The first step is to identify a list of patients that qualify for CCM for your practice. You can accomplish this by running a report in your EHR, set the criteria with patients that are 65 and older, that are on Medicare. They need to have 2 chronic diagnoses, and that they have been seen in the last 12 months. Once you create this report, you can obviously weed out any patients that you feel are not a good fit for CCM program for your practice. Once you have the report, the next step is in deciding how you're going to contact these potential patients through a letter, patient portal, and or an office visit. Establish who will contact the patient monthly and be available to answer patient calls. How are you obtaining consent, and where in the EHR that consent can be found? If you're going to do it written, where are you going to the chart note? And if you're scanning it in, who will review and update care plans, and who is responsible for billing for CCM services monthly? You want to provide the patient with how and when the bills will be generated and what the patient's obligations are for payments of deductibles and coinsurances that are not covered. If they don't have a supplement, then those won't be covered. They'll have to pay those out of pocket. To have a successful CCM program, it will require a team effort from all your physicians, staff, office staff, and the patients and their family. As we discussed previously, you must have a comprehensive care plan in place to document the patient's medical, functional, and psychosocial needs. Most EHRs have built-in care plans that you can customize for CCM, but you also can create a care plan template that can be completed outside the EHR and scanned into your EHR after completion. Just want to make sure that if you're utilizing a scanned template, that you want to label that specifically for CCM and train your staff where to find that. You're also responsible for providing this care plan to the patient. The best way to provide that care plan to the patient is by signing them up for your patient portal and making sure that that scan document crosses over to the portal so that they can have access to that care plan 24/7. CMS is adamant about documenting time spent. Set up a system that can keep track of time spent on non-face-to-face services provided. This includes phone calls and emails with the patient, time spent coordinating care by phone or other electronic communication with other clinicians, facilities, community resources, and caregivers. Time spent on prescription management, medication reconciliation. To count the time towards the 20 minutes of non-face-to-face, the care must be contact initiated. This includes patient doctor, patient nurse, doctor, pharmacy doctor, lab doctor, or other contact regarding the patient. General planning time, care coordination, that does not count unless it is initiated based on contact or results in patient-related contact. So just planning to call the patient, that kind of thing does not count towards the 20 minutes. In-person visits also do not count towards CCM codes. So now that we've covered all this, does the idea of starting a CCM program in your office seem like a daunting task? Most practices across the country are already facing huge staffing shortages and simply just don't have the time or the staff to start a CCM program at this point. This is how we can help you. With DAS, we have our turnkey program, and our chronic care management program will help you seamlessly extend your practice to enhance quality of care to your patients. Taking care of your patients and your practice, those with existing chronic conditions are most at risk for contracting COVID-19. Helping these patients manage and overcome their health obstacles has never been more important. DAS Health has an extensive chronic care management program with dedicated care specialists ready to deliver patient-centered solutions with industry-leading technology and 24/7 care coordination through monthly telephone checkups. Now you can improve health outcomes while generating an additional source of revenue for your practice. Early data shows that in general, CCM services are increasing patient and practitioner satisfaction, saving costs, and enabling solo practitioners to remain independent practice. CMS is continuing to reinforce their commitment to CCM in 2022, aiming to significantly increase utilization. Our dedicated care coordination team has already incorporated changes to the CMS care plan guidance in our workflow. We provide a dedicated care team that contacts patients monthly at a convenient time for the patient in the comfort of their own home. Our care coordinators are trained for intentional listening, responsiveness, and compassion to your patients. Consistent care plans integrated into your EHR without the need for new software or hardware. We also work within and as a complement to your existing EHR. Accelerated patient enrollment allows our specialized enrollment team to contact patients, educating and enrolling those who consent. Peace of mind in the event of a CMS audit by meticulous time tracking, documentation, and reporting to ensure all services are fully compliant. By choosing our CCM program, your patients will receive enhanced monitoring and coordination of care between office visits, enriched patient practice relationships, increased monthly office revenue and profitability, improved access for patients while eliminating unnecessary emergency room visits and hospitalizations, streamlined, accelerated, and consistent patient enrollment. Ongoing support and communication. We are there every step of the way. Our goal is to make a positive impact and to ensure the success and satisfaction for you and your patients while increasing revenue without adding any additional cost or burden to your staff. Our easy implementation and direct access to our dedicated account management team make our CCM program a definite right step for you. Benefits to the patient from our CCM program are regularly reviewed and updated personalized care plan, help with medication management, coordination with your complete care team, primary care, family members, hospital, specialist, resources and encouragement for them to stay on track with their health goals, and early identification of any potential health issues they might have, and a centralized record for all of their doctors in a care plan. Are you ready to take the next step and implement our turnkey CCM program at your practice? If you're interested in learning more about the DAS CCM solution, please feel free to reach out to your DAS account manager for more information. They'll be able to provide you with additional details and contact us to provide a more in-depth and overview or demonstration. Thank you so much for the opportunity to present our chronic care management to you today. I am really passionate about this program and all it can offer for you and your patients. And please feel free to contact me at any time with any questions. And our contact information is listed here for both Lindsay and myself. I will now turn it back over to Chelsea for questions.
Awesome. Thank you so much, Brandy, and thank you, Lindsay, for presenting the information as well. And again, thank you everybody for joining us today. We still have a bunch of time left, which means that we both have plenty of time to answer questions, and also probably will get some bonus time back in everyone's day. So yay for that. So again, if you have questions, you can type them in the questions area of the webinar control panel. We're going to go through them in the order that we've received them. So far, we only have 3. So if you have any questions, now is a great time to ask them because we do have plenty of time to answer. Okay, so first question, how specifically does it integrate into our EHR? Brandy, do you want to take that one?
Yes, so our care team does a care plan outside of your EHR, and then they scan that in. They do have direct access to your EHR to send messages to the provider if that's what the provider prefers. So yes, it's scanned into the EHR at this time.
Great, thank you, Brandy. And Lindsay, looks like this might be a great question for you. We already have your RPM services in place. Can we also do CCM for additional billing opportunities?
Yeah, I can grab that. And the simple answer is yes, absolutely. So we have a lot of clients, who have both CCM and RPM services in place. They do complement each other very, very nicely. Brandy, feel free to jump in and add anything on that as well, since I know you are a product expert on RPM as well. But all roads lead to yes. Feel free to take advantage of both programs, and RPM actually applies to a broader population base as well. It's not as restricted as CCM, so we see both deployed in practices all the time.
Okay, great. And it looks like this might be our last question, but if you do have more questions or if you're scared to ask them right now because it's in the big scary webinar format, you see both Brandy and Lindsay's information up on the screen. Feel free to reach out to them directly. You can also reply back to the email that I sent with the invitation to the webinar, or also to the slide or to the email that I'll be sending out shortly here with the link to the slides and recording. Basically, any way you can get a hold of us, we're happy to help. That's why we're here. We're here to answer your questions and help your practice, truly thrive in this current environment. And there's a lot of opportunities out there that your practice should be considering taking advantage of. So last, hopefully, maybe. Otherwise, again, if you're still typing, we'll stay on for a few minutes. We're here to help. So next question. Can we enroll patients on our own in our office into the program? Brandy, do you want to take that one?
Yes, you definitely can enroll patients in your office in the program. You can also bill a separate code for that. As Lindsay mentioned in the webinar, it's the G0506 code. When you enroll those patients, you can make sure you have the consent in the chart and just follow the rules that we talked about earlier, and definitely take advantage of that code.
Okay, great. Well, it looks like that's probably it. Don't forget to follow us on social media, LinkedIn. We frequently share breaking news, tech tips, different changes in legislation that you need to be aware of. So, please do give us a follow and feel free to reach out to us on there with questions as well. And thank you everybody again for joining us today. I hope you enjoy the rest of your week and have a great day.
Thank you, everyone.
Thank you so much.